think the work placements was the biggie on why I chose doing T-level. You got more opportunities doing a T-level than you did a BTEC, and it was a new thing that the government brought out, and it seemed to be quite what everyone was talking about and what everyone wanted me to do as well. So my industry placement with WWL, I was in the hospital on a stroke ward from November till March, and then I was on a cardiac and respiratory ward from January till March as well. And I did every Thursday for that time from 7:30 till 3:30, and I basically just shadowed HCAs, nurses, went around with different multidisciplinary teams and saw what the life of working in a hospital ward was like. So the placement next year, it's still with WWL, but it'll be on different wards, so we'll be allocated different wards this time. The best aspects at WWL are working with different teams on the wards and understanding how they all work together and collaborate to get the best possible outcomes for patients. I think that's what I've learnt most from working there. So on my placement, what I got to do was I'd shadow different people different weeks. So like on a week where I shadowed the nurses, I washed and dressed patients, I did bandages, things like that. I also inserted cannulas and catheters and removed them as well. I fed patients, I gave them washes. I also spent a week with the physios where I helped with the movement and getting them back up on the feet from where they couldn't walk to where they did walk. And then I shadowed occupational therapists where they use adaptations to help improve people's physical mobility as well. I think definitely the work placements are the benefits of being on a T-level course. We get 150 hours per college year, and I feel like that's a good amount of time to be able to find out what it's really like. It's not sugar-coated. We understand what it's like in the hospital, and we're treated like the staff there. We're not treated like children. We're treated like we're a member of the staff, and we're given that responsibility as anyone else would. And I feel like WWL really helped with us. We had a week training course with 2 nurses, and they trained us ready to be onto the course, and before we went on a placement they got us understanding what it was going to be like and how to respond to that as well. I shadowed physios as well, but I also looked at what speech and language therapists did whilst on the stroke ward, and I didn't even know that existed. And also what the sisters do in the managerial roles, all along to what domiciliary care do, such as the housekeepers, and it's really helped broaden my horizons and what I'd like to do in the future. I do want to be a paramedic, but after working on the wards as well, seeing quite vulnerable people, I'm leaning towards it's prison nursing / social work nursing. I feel like the Education Skills Partnership with WWL has helped me gain the qualities that I'll need to get a job in the future as well. From the things that I've seen and the skills that I've gained on placement, I'm able to apply for jobs in the NHS, such as the NHS banking staff that I can do now because I'm 18. And I feel like it's given me the experience that I need to apply to those jobs and feel confident in applying as well.
I decided to do a T-level because I liked how much it mixed practical with theory, those elements together, and the main factor is the placement hours. I like how many I was given. At Wigan Council, I got to work with a team of social care officers and was able to see what type of healthcare plans they were able to give their patients and how they worked with them in a person-centred way. I'm currently at a placement called More Than Words. It's a day centre for young adults with learning disabilities, and whilst I'm there I work with them to ensure that they're comfortable, that they're enjoying their time there, that they complete anything that is given to them, and at the end of the day I sometimes have to write notes about what they've done that day, if anything's made them upset, what they've enjoyed, just stuff like that really. I've enjoyed the range of different disorders I've worked with. In my first placement with the Wigan Council, I got to work with old people with dementia or with mobility issues, and in my new placement I get to work with young adults that have Down syndrome or autism. I just enjoy learning about new things. I found that I really enjoyed working at More Than Words and working with people with learning disabilities because there's such a range of different aspects that go on with each disability and how it affects each person differently. because of that, I think I may want to go into that into the future, but I'm not sure yet. In my first placement with Wigan Council, I worked with occupational therapists and was told what they do, how they can help around the house, what adaptations they can make, all stuff like that, as well as the social care officers and what they do on a day-to-day basis, all the phone calls they make, all the paperwork. The benefits of doing a T-level is, I think one of the main aspects is the amount of hours I get for work placement and how much I get to spend out in the community working with so many different people. As well as this, I get a lot of hours in college doing all the practical stuff that I may need when I leave college, so that can help me further in the future with my job roles, applying to uni, for my CV, everything really.